Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Brechner, president at R3, and each episode, I sit down with our founder and CEO, Dr. David Greene, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine. Welcome back, everyone, to episode 6 of Stem Cell Genius. We're going to talk about today the difference between the stem cells we use in the United States versus internationally. I have Dr. Greene here with me, as always, and I think I've deemed him our genius officially, and he's going to tell us a little bit about the differences today. So, Dr. Greene, if you could start off by telling us about the type of stem cells and how they're used in the United States.
Sure. So first I'll beat around the bush a little bit. It's interesting because in the United States, a lot of people have a negative opinion of the FDA. But when we go international, as you well know, people look at it as the gold standard because U.S. actually has a budget. The FDA has about a $9 billion budget annually. I think it goes up every year. So they do actually care about the safety of Americans, and they do have a lot of rules and regulations, which is very different than most other countries that we encounter. So as a result, we have to operate very differently as a lab here in the U.S. than we would around the world. So that should be noted up front.
Yeah. Thanks for that. So I guess now we have our disclaimer out there. Tell us about the stem cells that we do use in the United States.
So there's a distinction between what the FDA does versus, the practice of medicine. Back in the 80s, Congress made it very clear that the FDA does not regulate the practice of medicine. And sometimes, the FDA has forgotten that. They kind of overextend their purview and they get their wrist slapped in court. But we have to abide by their regulations in the United States when it comes to how the biologics are produced and the quality control measures as far as safety to make sure that we're not producing and distributing something that hasn't been fully tested for safety. So the FDA has, by the way, if you ever have insomnia, just go on the FDA website and just start reading some of the regulations. You'll be out in like 2 minutes. It is the cure for insomnia. But they do have a whole handbook regulations called Part 361 and Part 351 under the Public Health Services Act, Category 1271. So a 361 is a tissue product that is allowed under the FDA regulations and what's called minimal manipulation. So we make several products here at the lab through minimal manipulation methods, and those are Part 361. Part 351 is when you make a product that is maximal manipulation under their category, and that technically would need a clinical trial and an FDA approval to market and use in the United States. So do you want me to go through each of those in depth?
I don't know if we need to put our listeners to sleep, but it's a good thing that you read all of these and you can dumb them down for the rest of us.
Yes, exactly. So, patients ask us this all the time, hence the reason, it's a good topic for a short podcast. But what patients will say is, what's the difference between getting treatment here in the United States with stem cell therapy versus, internationally, such as Mexico?
Right.
Because Mexico is pretty close, right, for most people. And we have 3 clinics in Mexico, and we can produce our biologics very differently there. So the first thing is that in the United States, we're not allowed to culture the stem cells.
Right. And tell us what culturing means.
Well, if you take one stem cell and you use growth media to make it split into 2, and then those 2 then split into 4, and then 8 and 16, that's basically replication, which is what happens when stem cells expand. And that's another term for culturing them.
So you can think about it as if you're just cloning the stem cell. And we clone it really until it's not really a good clone anymore.
Right. You don't want to, bring in the negative implications of the word cloning, but that's basically what's happening. And that happens every day in our bodies anyway.
Right. Okay.
Stem cells go through mitosis and they make an exact copy of themselves. However, you can go too far with that. And what happens is once you get past like the fifth generation or fifth passage, we call it in the lab, stem cells will start to not really look like they did before. They don't act like they did before. They become non-functional, and they can accumulate, DNA damage and potentially promote a cancer or a tumor.
Okay. So tell me what you think about this other analogy. Maybe the live stem cells, I'm comparing them to diamonds now. So, we have natural diamonds and lab-grown diamonds. Do you think that that's maybe a closer analogy? We have the live stem cells, natural diamonds, and then we have the lab-grown diamonds, which essentially look the same and make people feel the same. And, is that kind of a better comparison to the culturing of stem cells?
Yeah, did you just think of that like right now, or did you think about that like prior? Because that was a really good analogy.
Thank you. I actually used it last week for the first time.
You did.
I did, because somebody was like, what really is the difference? And I used the word clone, and they were like, they understood. But then, I have been looking at rings recently. Hint, to some of our listeners, one specifically. And, I had to make the decision, would I prefer a natural diamond or a lab-grown diamond? And, it comes down to just, what's your personal feeling on, is it romantic, is it not? But deep down, really, it is just like the stem cells.
It is. But, so many questions here. So, first of all, you're assuming that your boyfriend actually listens to the podcast.
Sometimes I make him. We go on a road trip. I'm like, you haven't heard episode 3 yet.
I don't even know if my wife listens to the podcast. She said, she would say, who's the genius? Because it ain't you.
Well, good thing today I officially have deemed you our genius.
And she would follow it up by, don't forget to take out the trash, moron.
And give me some more lab-grown diamonds.
Yeah, that's right. That's right. So it is a good analogy. In the lab, we're GMP. So GMP compliant means we don't use any animal reagents or anything that doesn't come from a GMP supplier, which sometimes can cost 10 times more than what some of the labs use that are less than stellar quality. But, as a patient, you don't want any animal type of reagents with the potential implications of that. So I want to say that up front. Wherever we have a lab, and we have 3 of them now, then we're GMP. Now, when we do the culturing of the stem cells, we use reagents that come from GMP sources, and then we monitor them through the flasks through, like I said, 5 passages. And if you stay within those parameters, then they are very high quality, they're very pure, highly viable, and they work extremely well. And there's thousands of peer-reviewed research studies on the mesenchymal stem cells that we use around the world for patients, and the results are just unmatched. Some of these new technologies that come out, they might tout it as the next best great, but they probably haven't gotten past either animal studies or just very early in clinical use. And, we want to give them their, money's worth, so to speak, and get the best results possible.
Yeah, absolutely. Well, and it definitely explains also just our price points too, why we're able to lower the costs internationally by being able to culture them. So
yeah, I think it's a good point to mention what happens with a lot of other labs. And I got that question this morning from a patient in South Africa, actually. She was considering going to India. And, we get these price quotes all the time. Well, can you match this? Well, 100 million stem cells for like $2,000 or something like that. If you're a GMP lab and you're looking out for the safety, first and foremost, of your patients, there's no way you can make 100 million stem cells at a cost of goods of $2,000. It's just not possible. So what they're doing is they're overculturing and they're skipping some of the safety steps.
Right.
So wherever our labs are and wherever our products are being used, we're making sure that it's the USA FDA regulatory quality control standards that we're
both
following.
in and outside of the United States.
That's exactly right. Yeah. So you don't want to skimp. The last thing I would want to do. I mean, I'm using these stem cells myself. You are, our families. I would never want something for a patient that I wouldn't use for me or my family. Yeah.
Absolutely. No, I think that's the right way to do it. Why would we give something to people that we didn't believe in, right? It's just not ethical. So now talking about how we don't culture the stem cells in the United States, what do we do to get the stem cells in the United States if we can't culture them?
Yeah, that's the real question. And first and foremost, people need to understand that stem cell therapy is legal in the United States. We get this all the time. I was dealing with it this morning. Over the weekend, we were treating a lot of patients. And they were like, I didn't even know I could get it here in the United States. This is amazing. I thought I was going to have to go to Panama, Colombia, Mexico. No, you don't have to. We are allowed to use these products in the United States. As we discussed earlier, the FDA does not regulate the practice of medicine. Physicians are allowed to use these biologics if they deem them to be safe and effective, in consultation with the physician-patient relationship.
Right.
So we're able to use the following types of products. First and foremost, we get umbilical cords that are donated through accredited agencies.
Right.
And we process them. We don't use enzymes, we're not culturing them. Basically, we grind them up with a sterile FDA-approved kit, and then we basically filter them and then put them into vials. So in there's millions of stem cells, there's billions of exosomes and growth factors and cytokines, and we use a little bit of cryopreservative, which the FDA is fine with, to make sure that the stem cells stay viable. So that is a cellular product that we use for joints and other injections, and it works fantastic. It's available right here in the United States, and we use it every day.
Yeah. So essentially, it's the stem cells. But on top of that, because we can't just pull them out, it has all of these other awesome things in it too.
Yeah. I mean, you can refer to it as a biological soup, or some people, I like to call it a virtual orchestra of regenerative elements. Whatever the analogy is, you're right. It's like, why get just a star pitcher when you can have the whole baseball team?
Right. And so I know that for injection purposes, we use the Wharton's jelly. But, when everybody hears the word jelly, we hear, okay, that's really thick. How is that administered in other areas, maybe like in an IV?
Yeah, when you have these products, they do have the extracellular matrix in them, which is fantastic for injection procedures. But we don't use that IV because it does have the extracellular matrix and some particulate matter. Yeah, exactly. So there's other things that providers will use IV. For instance, we have an umbilical cord blood product that our clinics around the world and here in the States use IV. It doesn't need a filter. People get concerned about the word blood because because it has, when you get blood, it's red. It has red blood cells in it. That's what makes it red. But during the processing, those are all removed.
Okay.
There's multiple different ways to do it. We don't need to get into the weeds on that.
Sure.
But it could be a magnet. It could be a gradient filtration. But basically, the red blood cells are pulled out, so the product's clear. There's no rejection possible, and we've been using it for over a decade now.
Absolutely. And then obviously exosomes can go anywhere.
Yeah, exosomes are byproducts of cells. We have them in all areas of the body, urine, lung fluid, saliva. We don't really care about those. We use them as a byproduct of the umbilical cord stem cells. They are not cells. They don't replicate.
Right, they don't have a nucleus.
They don't have a nucleus, but they do have tons of proteins in them. They're very active in cell-to-cell communication. So over the last 5 years, we've been using them typically in conjunction with the cellular products to get amazing results for patients. And we use exosomes all over the world with, here it's non-cultured products, but internationally, it's cultured products plus the exosomes. And I think that has put us really at the forefront of the field because a lot of centers don't even know. First of all, they don't even know that that's a great combination. Second of all, it's too expensive for them to do them together. They don't have the economy of scale necessary to make that affordable, or they charge too much.
Right. Well, and, I think a lot of our patients also ask, if I'm getting Wharton's jelly, is it beneficial to even get exosomes? Because there's exosomes in the Wharton's jelly too, in that biological soup. And I know you always say, I'll let you say it.
More is better.
Yeah.
More is better. That's true most of the time. But, some of our competitors, I won't go into their names, but we hear the same ones all the time, will say exactly that. Well, the stem cells have exosomes in them, so why give extra? Well, why give extra is because more is better in that case.
Right.
The exosomes work very quickly for either neuro repair or facilitating, repair of tissue that's damaged in the lungs or kidneys or what have you. And then the mesenchymal stem cells from umbilical cord work a little slower, and they're going to last, a little bit longer.
Right, that's what's doing the heavy lifting.
Yeah, so what we developed with our PhDs around the world is we actually trademarked it. It's called the regenerative trifecta, which is a proprietary combination of exosomes, mesenchymal stem cells, or Wharton's jelly, or the expanded ones outside the country, and PRP.
Right.
So that combination has put our outcomes leaps and bounds forward from what they used to be and from what we see from any of our competitors.
So let me ask you this scenario. I live in Southern California and I have the option to go to an affiliate center of R3 stem cell in San Diego, and I have the option to go to Tijuana. What do we think is best? I mean, is it, in the end of the day, going to be the same treatment? Do we think that one is better than the other?
Let's go through a few facets of the answer. And I'm going to make a little note here. One is personal safety. Another one is biologic safety. Another would be price.
Right.
And the other would be, we'll call it efficacy. Is it going to work? All right, so personal safety first. We've had our clinics in Mexico for 8 years now. I'm going to knock on wood. We've never had a personal safety incident. You and I go there all the time to do filming or get procedures on ourselves. And basically, people fly into San Diego. We fly into San Diego.
Yeah.
The team, our logistics team, picks up the patients just like they pick us up.
Right.
We have like a Mercedes SUV and other vehicles. Then we go, it's about 15 minutes to the border, and that's quick. And then it's literally 3 minutes from the border to Rio Zona to the building. It's very quick. And Rio Zona, to be honest, it looks like downtown San Diego.
Right.
It's
I agree.
A quiet neighborhood. There's no nightclubs or
or
any of that. It
feels like more of a medical district almost.
Yeah, it's kind of like a boring medical district. We're in a high rise, a very nice clinic. So from a personal safety standpoint, never had any issues with there or Cancun or Puerto Vallarta, and it's the same internationally too. In South Africa, there's some dicey areas of South Africa. We're in the Melrose district. I have never seen an area that nice.
Oh, really?
Yeah, it's so nice. There's a Rolls Royce store there. There's a really nice Marriott literally right across the street. Great restaurants. It's very, very safe. A lot of law enforcement presence. And
I mean, I would say that all of our international clinics are in safe areas, especially for medical tourism.
Yeah, I mean, no doubt. There's a reason we pick the areas that we do for that those reasons. From a biological safety standpoint, there are no differences wherever we are.
Right.
The quality control standards are equivalent or exceed the USA FDA. In their regulatory handbook, you can read about what they require to be tested for, and that's exactly what we test for, and then we do a few other tests on top of that.
We exceed the requirements.
Yeah, and then we do a statistical analysis. Basically, if we have 200 vials from a batch, we take 10% or 20 of them, and we send them to a third party to basically culture them for sterility, looking for bacteria, virus, fungus. And we wait until all of them come back negative, and all the disease testing has to come back negative. The donor history has to come back, pristine. Then and only then will our medical director release the biologics.
Right. And we don't get that 10% back, right?
No. Oh, no.
Yeah, we don't get that 10% back. And then if anything does show up in the 14 days of sterility testing, we discard the entire batch.
Yeah, and unfortunately, we've had to do that several times over the years. It's not fun, but, we don't want there to be any question of quality control, being top notch.
Yeah, absolutely.
So another thing I want to mention is that there are certain procedures, application types that we just really don't do in the States as opposed to international. So if a child has autism or an adult has like a stroke they're dealing with, if an adult has multiple sclerosis or something that we'll call central nervous system issue, CNS for short, we want to get millions and millions of stem cells into the central nervous system. Oh, how do you do that? Well, you can do a little bit through an IV, but cells don't often get past the blood-brain barrier. You can do some intranasal, and that gets a certain percentage, and that can work very, very well. But the gold standard for getting mesenchymal stem cells, just avoid the blood-brain barrier altogether, is to basically do intrathecal application, which in layman's terms I call a reverse spinal tap. And that works unbelievably well, for patients who have these significant CNS issues. So we do that in Tijuana. We do it basically everywhere in the world except, for the USA.
Right. I know we have a few providers in the USA, but honestly, our international providers just do it so often.
Yeah. I mean, Dr. San Miguel, for instance, in our Mexico locations, he's done over 500 of them with us. I'll knock on wood again, which I do all day long, but we've never had a spinal leak or infection or anything that lasted more than a few hours, like with a headache or something like that.
Right.
The rest of our providers are so good at these. And we usually do them under sedation, like for children, but it works really well. It's very fast. And that's something we do, all the time in Mexico. Other types of applications that we do frequently would be transvaginal ultrasound injections, although we do those in the States too.
Just for sedation.
We do a lot of conscious
outside of the
sedation
US.
around the world. So those might be an extenuating circumstance that you want to think about. And, our concierges are well versed in helping guide patients to those decisions. From a pricing standpoint, we really have what I would call 3 levels of pricing globally. One is the United States, because we are not allowed to culture. We have to charge a little bit more in the States for that, and other reasons that are pretty obvious. So there's the USA pricing. Then there's the pricing we have in Mexico, South Africa, Turkey,
the
Philippines. Yeah, they're all very, very similar. They're about, I don't know the statistic.
I'd say about 30% less.
30% less.
Somewhere around there than the US.
Yeah, and that part of that is because we can culture the stem cells, and it makes it a lot more affordable, but just as effective.
Right.
And then the third tier would be Pakistan and India, where, we have to compete with those countries, and we do that very well, but it makes it the lowest price tier, if somebody's interested in, sometimes we have people who go to our Delhi location, and it's only a couple hours away from the Taj Mahal.
Yeah, I went last time I was there.
Yeah, it's
like
amazing.
A 3-4 hour drive.
Oh, it's more. Okay, yeah, I forgot. It's incredible. It looks like a freaking postcard.
Oh my gosh, it was the most amazing thing I've ever seen. I mean, I couldn't believe I got the privilege of going when I got to visit our clinic.
I mean, I can't remember. It was like 20,000 workers worked on that thing for a ton of years, and at a real day cost of like $6 billion or something crazy. Anyway, I don't want to get off track too much, but from a pricing standpoint, there are some savings internationally that, just can't be ignored.
Right. But you also have to factor in the cost of travel.
That's right. Yeah.
Right. So sometimes it makes more sense to just go to your local R3 stem cell in the United States.
Some patients well, a lot of the country, doesn't really have a passport. So, but in Tijuana, you can get back with a birth certificate and a driver's license. A lot of people don't know that.
Okay.
So that's something that, you may want to think about. But, some people just aren't medically fit to travel.
Right.
So thankfully, we do have the options here in the USA. And there are times, for instance, at our corporate locations, which we're sitting in Scottsdale, we have one in Beverly Hills and Nashville, there's sometimes where we can do a price match.
Right.
Yeah, so that's...
to Mexico or the tier 2 pricing location.
Right. Exactly, yeah. And that's exciting. There's not many places around that would be able to do that, but when you're over 27,000 global procedures and you have your own labs, then it makes it very, very possible.
Absolutely.
So the last one is efficacy. I saved the best for last. Our patient satisfaction rate is 85%.
And how do we track that?
So, it'd be one thing if we looked at parameters for, your GFR for the kidney has gone up X amount, or this has happened. Well, what we care most about is, would you do it again?
Yeah. How do you feel?
Yeah.
You know?
Would you recommend it to friends and family? How are you doing? Are you on dialysis? Did you stay off of dialysis? Things that make people happy, right?
Improve their quality of lives.
Yeah, so we asked them, we have a large follow-up team, so we asked them a day, a week, a month, 3 months, 6 months, a year. And at the year point is the data that we use. And year over year, it's been 85%, give or take a percentage point or two, that say, yes, they would do it again and recommend it to friends and family. So, people sometimes around the world, they want a guarantee or they want a definitive cure. They want the miracle. And I feel like we've been very good about being transparent with patients and with our educational efforts to be accurate with our expectations, because just like anything else in medicine, some people are humongous responders and others, unfortunately, are not. Right. Thankfully, it's not 50%, it's 15%. And doesn't mean that those all failed. It just means that maybe they were expecting too much, or our providers told them what to really expect, but they kind of heard what they wanted to hear.
Right.
And that's unfortunate.
Or maybe they didn't follow proper post-procedure protocols.
That's true. Yeah, we asked them, to try and quit smoking for permanently, but, at least for a period of time, or to stop, alcohol intake or whatever the case may be. Obviously, some people are non-compliant with those.
Right.
So those are some of the main differences that we addressed.
Obviously, if your condition doesn't require you to go internationally, the choice is really up to the patient. It's what they really feel comfortable with. Do I want a minimally manipulated product in the United States, or do I like the idea of, further manipulating the product and culturing it and going internationally? Can I afford to go internationally physically and in my pocket, right? Those are questions that a lot of patients have to ask themselves.
You're right. I mean, there's a few more things. Like if you really wanted to combine a medical treatment with a vacay, then you can do that.
Right.
That's pretty much got Cancun written all over it.
I was going to say, I recommend our Puerto Vallarta location.
Puerto Vallarta, same concept.
Yeah.
Literally we're right across the street from the beach.
Yep.
In Puerto Vallarta. And if you want to go nuts, you can stay right across the street at the Hard Rock Hotel, or if you want to be a little more relaxed, you can stay at the Villages right down a couple of blocks away. So, either or. And then Cancun, you have the hotel zone. They're all on the beach. So, or if you just want to get in and get out, then, that's Tijuana for you.
Right. Absolutely. And then if you really wanted a little vacation, extent in San Diego.
That's right. Exactly.
Yeah.
We have a lot of people who do that because, we have a lot of people from the States, Canada, Europe. They have direct flights to, say, Cancun. It's all about what you're looking for.
Right.
And then internationally, too. Some people, they come in the Philippines and there's some great beaches.
Our clinic is in Manila. Then you hop on a 45-minute flight to the most beautiful beach that you've ever seen.
Exactly.
They have tons of islands all around, the mainland there. And, I loved going. I got to go to Intramuros in Manila and, I took a little tour around. It was awesome. And then even when I went to our New Delhi location in India, I took a little trip to Taj Mahal. We've got a lot of great places for medical tourism.
Yeah, no doubt. The last thing before we, finish up is I do want to once again warn prospective patients about cheap stem cell therapy is a terrible idea.
Yeah.
We use the term affordable, and I don't think we're going to be we just are not the cheapest.
Right, but we're definitely not the most expensive.
Oh, absolutely. We are by far, in a very, very good middle range for combining safety with effectiveness and convenience. With being in 8 countries at this point. So I just want people to think twice before they make a decision based solely off of price. Yeah. I can't tell you how many times a week we get calls from folks who've been to one of these cheap clinics. Either they had a very bad experience with a complication or they just didn't get any results.
Right. And to a certain extent, we can't predict the results. When we put the stem cells in your body, they're going to do something, right? Whether or not you keep up with them, we can't control that part. That's your half of the equation. It's not like we're telling you have to be bed rest for 6 weeks on crutches or what have you. I mean, it's cost effective, it's minimally invasive, and it's safe.
We could think of, we'll have to look up synonymous terms with genius.
Yeah, absolutely. I can say that I am the champion of stem cells. You can ask Shannon Briggs
Shannon
herself.
Briggs, yeah, that's right. That's right.
For those of you that haven't seen our treatment with Shannon Briggs, go out and check it on YouTube and Instagram and Facebook. It was a very large privilege to be able to work with Shannon Briggs and all of our, other talents, I should say, that come and trust R3 stem cell for their regenerative therapies.
So while you were working with Shannon Briggs here, I was working with Butterbean in Nashville. I don't realize how small of an individual I am until I get up against one of those guys. I don't even know if I went up to Shannon Briggs's waist.
Oh my gosh. This is why when Dr. Greene does travel to our Philippines clinic, he does feel quite normal. Now, I'm a giant there. Everybody's looking up. I'm like a tourist attraction.
You are. Yeah. When we go to Bangladesh, that's where our call center is. I'm eye to eye, man. It is just awesome. It is great. I'm like, wow. It's not like the giant versus me.
That's okay because you're a genius here.
Yeah, that's right.
So
exactly.
It makes up for it. Shout out to our tiny champs out there. All right. Well, you could visit us online at r3stemcell.com. Check out our YouTube channel. We have over, I think, 1,000 educational videos and testimonials on there now. And give us a call at +1 844-GET-STEM. See you next time, champs. Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.